Hello, everyone. My name is Philip Kimsey. I'm a family physician and a functional medicine practitioner. I have been in practice for over 25 years. And in regards to my functional medicine practice, I specifically treat patients with depression and those patients who have treatment-resistant depression. And I'll tell you a little bit more about that in just a minute. So you may be asking, what is functional medicine? So functional medicine is a groundbreaking field of medicine that has really turned a lot of heads in the last several years. And it is really the only branch of medicine that I know that looks to get to the root, the bottom line of why people have certain illnesses and diseases. It is a very intense way of looking into a patient and their overall health. So let me tell you about my journey into functional medicine. I actually had my own health issues about 13 years ago. I was profoundly fatigued, not doing well at all, struggling in my work, struggling in my home life, and my health was deteriorating rapidly. Went to see my doctors, went to see several physicians, had the routine workup, and they really could not find anything. And they basically attributed it to maybe overwork and exhaustion. And I'll give them credit for that. It was, but let me tell you more. So again, the testing didn't come up with anything. So I was at my wit's end. I was really not able to perform at home or at work very well due to the profound fatigue. So I went to see a functional medicine practitioner, and then my journey began. So through a series of several weeks and months of testing me and evaluating me with some tests I had actually never heard of, and I was never taught about in medical school, they discovered that I had adrenal fatigue. And within a matter of weeks, with a customized and designed plan for me, with appropriate lifestyle management, diet, and supplements, my health began to turn around. And I've been on the road to recovery ever since. And it's something that's been priceless for me. I was able to get my health back and to be able to practice and live life once again. But it doesn't stop there. My wife and my three daughters, all themselves, were recipients of functional medicine treatment. They themselves were having issues, went to see their physician, did the tried and true testing like I did as a family physician, couldn't find anything. It was only until we established with a functional medicine practitioner, got the appropriate testing, got the appropriate consultation, that they discovered the origins of their problems and were able to help them as well. So we're very thankful for functional medicine as a family. So now, how can functional medicine help you? As I said before, I treat specifically patients with depression and treatment-resistant depression. When I was doing my regular family practice, before I started doing functional medicine, it was always a struggle to take care of patients that I really had reached the bottom. I could not help them anymore. I did not know anything. I did not have any more tools on my belt, no more weapons in my arsenal to help them. But I knew that there was something more that could be done for them. And it was only because of my own experience and me being helped that I knew that functional medicine had a solution for a lot of these patients, specifically my patients who struggled with depression. That's got to be one of the worst illnesses anyone can struggle with. And to be tired, to be so fatigued, to not be able to think straight, to have all the emotional upheaval, the troubled relationships, the inability to work, the inability to carry out duties at home. Depression is pervasive, and it can go deep, and it can profoundly affect a person's life. And sometimes I'm so very thankful for the medicines that we have, and I'm thankful for the therapy and the counseling that can occur. But sometimes even then, it doesn't get to the root. Well, the interesting thing is functional medicine has been able to help a lot of those patients who have not been able to be helped by conventional treatment. So if you're somebody like that who struggles with depression, who has been to doctor after doctor, tried several medications, maybe they've helped some, or you tend to have backslides into depression, then I'd like for you to strongly consider giving functional medicine a try. So how would it work? After this video, you'll have the opportunity to connect with me. I'd like to speak with you about the program that I offer in functional medicine for the treatment of depression and treatment-resistant depression. I'll map out things for you. The program entails me getting a detailed history of you, of your family, how your depression is impacting your life. What are your goals? What are the things you want to do that you're not able to do because of depression? I'll take that information into consideration, and then you and I will talk about the next steps, lab testing, other types of tests that possibly could be done. Let's get to the root cause. Functional medicine does that. It gets to the cause of many of these situations, and depression is one of them. After we've done all the testing, then I will design a customized plan for you, and this plan will be specifically for you. And over the next several weeks, you and I together, with me coaching you, encouraging you, educating you, and helping you, I'll take you through the plan. And I feel very confident that at the end of that time, you will be well on your way to reaching your goals. So I want to thank you for taking the time to listen to what I have to say. I would like for you to click on the link that is attached with this video, reach out to me, get in touch with me. Let's set up a time and talk and see what we can do to help you get better.